Depression, meaning, causes, symptoms, and treatments. Welcome to the Ultimate Wellbeing. Ultimate Wellbeing is a health and well-being channel. The Ultimate Wellbeing channel will help to improve your health and well-being. On this channel, you will see videos promoting good health and well-being that will assist you to improve your health and well-being to ensure your ultimate well-being. If you are new here, make sure to subscribe to our channel to get a regular dose of good health and well-being tips to become a better you for ultimate well-being. Relax, have fun as you see our videos and become a better you for your total well-being. Thank you. Depression, meaning, causes, symptoms and treatments are discussed in this video. Now, let us start. While we all feel sad, moody, or low from time to time, some people experience these feelings intensely, for long periods of time, weeks, months or even years, and sometimes without any apparent reason. Depression is more than just a low mood, it is a serious condition that has an impact on both physical and mental health. What is depression? Depression is the main cause of disability worldwide, according to the World Health Organization, WHO. It can affect adults, adolescents, and children. Sadness, feeling down and having a loss of interest or pleasure in daily activities are familiar feelings for all of us. But if they persist and affect our lives substantially, the issue may be depression. Depression is a mood disorder that involves a persistent feeling of sadness and loss of interest. It is different from the mood fluctuations that people regularly experience as a part of life. Major life events, such as bereavement or the loss of a job, can lead to depression. However, doctors only consider feelings of grief to be part of depression if they persist. Depression is an ongoing problem, not a passing one. It consists of episodes during which the symptoms last for at least 2 weeks. Depression can last for several weeks, months, or years. Types of depression. There are different types of depression. The symptoms for each can range from relatively minor to severe. Major depression. Major depression or major depressive disorder is the technical term used by health professionals and researchers to describe the most common type of depression. Other terms sometimes used include unipolar depression or clinical depression. Depression can be described as mild, moderate, or severe. Melancholia. Melancholia is an older term for depression and is still sometimes used to describe a more severe form of depression with a strong biological basis, where many of the physical symptoms of depression are particularly evident. For example, one of the major changes is that the person can be observed to move more slowly or to be experiencing significant changes to their sleep pattern and appetite. A person with melancholia is also more likely to have a depressed mood that is characterized by a complete loss of pleasure in everything or almost everything. Dysthymia. The symptoms of dysthymia, sometimes called persistent depressive disorder, are similar to those of major depression but are less severe and more persistent. A person must have this milder depression for more than 2 years to be diagnosed with dysthymia. Psychotic depression. Sometimes, people with a depressive condition can lose touch with reality. This can involve hallucinations, seeing or hearing things that are not there, or delusions, false beliefs that are not shared by others, such as believing they are bad or evil, or that they are being watched or followed or that everyone is against them. This is known as psychotic depression. Antenatal and postnatal depression. Women are at an increased risk of depression during pregnancy, known as the antenatal or prenatal period, and in the year following childbirth, known as the postnatal period. This time frame, the period covered by pregnancy and the first year after the baby's birth, may also be referred to as the perinatal period. The causes of depression at this time can be complex and are often the result of a combination of factors. In the days immediately following birth, many women experience the baby blues, which is a common condition related to hormonal changes, affecting up to 80% of women who have given birth. The baby blues or the general stress of adjusting to pregnancy or a new baby, are common experiences but are different from depression. Depression is longer lasting and can affect not only the mother but her relationship with her baby, the child's development, the mother's relationship with her partner and with other members of the family. Up to 1 in 10 women will experience depression during pregnancy. This increases to 16% in the first 3 months after having a baby. Bipolar disorder. Bipolar disorder used to be known as manic depression because the person experiences periods of depression and periods of mania with periods of normal mood in between. The symptoms of mania are opposite to the symptoms of depression and can vary in intensity. They include feeling great, having plenty of energy, racing thoughts, little need for sleep, talking fast, having difficulty focusing on tasks, and feeling frustrated and irritable. This is not just a fleeting experience. Sometimes, the person loses touch with reality and experiences hallucinations or delusions, particularly about their ideas, abilities, or importance. A family history of bipolar disorder can increase a person's risk of experiencing bipolar disorder. Because bipolar disorder includes periods of depression, it is not uncommon for a person with bipolar disorder to be misdiagnosed as having major depression until they have a manic or hypomanic episode. Bipolar disorder can also sometimes be confused with other mental health conditions such as schizophrenia. The treatment for bipolar disorder is often different to that for major depression. It is therefore important to check for this condition whenever a person is being assessed for depression. Cyclothymic disorder. Cyclothymic disorder is an uncommon condition that is often described as a milder form of bipolar disorder. The person experiences chronic fluctuating moods over at least 2 years, involving periods of hypomania, a mild to moderate level of mania, and periods of depressive symptoms, with very short periods, no more than 2 months, of normality between. The symptoms last for a shorter time, are less severe and are not as regular, so they don't fit the criteria of bipolar disorder or major depression. Seasonal affective disorder, SAD. SAD is a mood disorder that has a seasonal pattern. The cause is unclear but may be related to the variation in light exposure in different seasons. SAD is characterized by mood disturbances, either period of depression or mania, that begin and end in a particular season. Depression in winter only is the most common way in which people experience SAD. SAD is usually diagnosed after the person has had the same symptoms during winter for 2 or more years. People with SAD are more likely to experience lack of energy, sleep too much, overeat, gain weight, and crave carbohydrates. SAD is more likely to be found in countries with short days and longer periods of darkness, such as the cold climate. Can depression be treated? Having described types of depression, it is necessary to ask the question, can depression be treated? The answer is capital yes, depression can be treated and managed. 1 in 6 women and 1 in 8 men will experience depression at some time in their life. The good news is depression is treatable and effective treatments are available. The sooner a person with depression seeks to support, the sooner they can recover. Symptoms of depression. Depression affects how people think, feel and act. Depression makes it more difficult to manage from day to day and interferes with study, work, and relationships. A person may be depressed if for more than 2 weeks they have felt sad, down, or miserable most of the time or have lost interest or pleasure in most of their usual activities and have also experienced several of the signs and symptoms across at least 3 of the categories in the list below. It's important to note, everyone experiences some of these symptoms from time to time and it may not necessarily mean a person is depressed. Equally, not every person who is experiencing depression will have all these symptoms. Feelings caused by depression. A person with depression may feel sad, miserable, unhappy, irritable, overwhelmed, guilty, frustrated, lacking of confidence, indecisive, unable to concentrate, and disappointed. Thoughts caused by depression. A person with depression may have thoughts such as, I'm a failure. It's my fault. Nothing good ever happens to me. I'm worthless. There is nothing good in my life. Things will never change. Life's not worth living. People would be better off without me. Behavioral symptoms of depression. A person with depression may withdraw from close family and friends, stop going out, stop their usual enjoyable activities, not get things done at work or school, and rely on alcohol and sedatives. Physical symptoms of depression. A person with depression may experience being tired all the time, feeling sick and run down, frequent headaches, stomach or muscle pains, a churning gut, sleep problems, loss or change of appetite, and significant weight loss or gain. Causes of depression. While the exact cause of depression isn't known, a number of things can be associated with its development. Generally, depression does not result from a single event, but from a combination of biological, psychological, social and lifestyle factors. Personal factors can lead to depression. Personal factors that can lead to a risk of depression include family history. Depression can run in families and some people will be at an increased genetic risk. However, this does not mean that a person will automatically experience depression if a parent or close relative has had the condition. Personality. Some people may be more at risk because of their personality, particularly if they tend to worry a lot, have low self-esteem, are perfectionists, are sensitive to personal criticism, or are self-critical and negative. Serious medical conditions. These can trigger depression in two ways. Serious conditions can bring about depression directly or can contribute to depression through the associated stress and worry, especially if it involves long-term management of a condition or chronic pain. Drug and alcohol use can both lead to and result from depression. Many people with depression also have drug and alcohol problems. Life events and depression. Research suggests that continuing difficulties, such as long-term unemployment, living in an abusive or uncaring relationship, long-term isolation or loneliness or prolonged exposure to stress at work can increase the risk of depression. Significant adverse life events, such as losing a job, going through a separation or divorce, or being diagnosed with a serious illness, may also trigger depression, particularly among people who are already at risk because of genetic, developmental, or other personal factors. Changes in the brain. Although there has been a lot of research in this complex area, there is still much that we do not know. Depression is not simply the result of a chemical imbalance, for example, because a person has too much or not enough of a particular brain chemical. However, disturbances in normal chemical messaging processes between nerve cells in the brain are believed to contribute to depression. Some factors that can lead to faulty mood regulation in the brain include genetic vulnerability, severe life stressors, taking some medications, drugs, and alcohol, and some medical conditions. Most modern antidepressants influence the brain's chemical transmitters, in particular serotonin and noradrenaline, which relay messages between brain cells. This is thought to be how medications work for depression. Other medical treatments such as transcranial magnetic stimulation, TMS, and electroconvulsive therapy, ECT, may sometimes be recommended for people with severe depression who have not recovered from a lifestyle change, social support, psychological therapy, and medication. While these treatments also impact the brain's chemical messaging process between nerve cells, the precise ways in which these treatments work are still being researched. Seek support for symptoms of depression. Depression is often not recognized and can go on for months or even years if left untreated. It is important to seek support as early as possible, as the sooner a person gets treatment, the sooner they can recover. Untreated depression can have many negative effects on a person's life, including serious relationship and family problems, difficulty finding and holding down a job, and drug and alcohol problems. There is no one proven way that people recover from depression. However, there is a range of effective treatments and health professionals who can help people on the road to recovery. There are also many things that people with depression can do for themselves to help them recover and stay well. The important thing is to find the right treatment and the right health professional for a person's needs. Treatment of depression. Depression is treatable, and managing symptoms usually involves three components. 1. Support. This can range from discussing practical solutions and possible causes to educating family members. 2. Psychotherapy, also known as talking therapy. Some options include one-to-one counseling and cognitive behavioral therapy, CBT. 3. Drug treatment. A doctor may prescribe antidepressants. Conclusion. Depression, meaning, causes, symptoms and treatments have been discussed in this video. Depression is a mood disorder that involves a persistent feeling of sadness and loss of interest. Depression is more than just a low mood, it is a serious condition that has an impact on both physical and mental health. Depression is the main cause of disability worldwide, according to the World Health Organization, WHO. It can affect adults, adolescents, and children. Sadness, feeling down and having a loss of interest or pleasure in daily activities are familiar feelings for all of us. But if they persist and affect our lives substantially, the issue may be depression. Depression can be treated and managed. Hope this video is useful and beneficial to you. We love to hear from you. Please post your comment below in the comments section. If you are new here, make sure to subscribe to our channel and press the notification button so you can get a regular dose of good health and well-being tips to become a better you for your ultimate well-being. If this video has been helpful and beneficial to you, then, give it a thumbs up, share it with your friends and leave a comment below. Kindly note that any information on this video is provided for educational purposes only. Diagnosis and treatment decisions should be made in consultation with your doctor. Thank you. Thank you for seeing the Ultimate Wellbeing videos.